Thank you, Mary. We are really excited to be here today to talk about food insecurity among students in Maryland. My name is Tamlin Kelly, and I work with Share Our Strengths, No Kid Hungry campaign. And I'm joined by my colleague, Nikardi Jala, who will introduce herself in just a minute. But for those of you who are not familiar with the Share Our Strength or No Kid Hungry, I just wanted to share some basic information about the organization here. I think most of you are familiar with us, but we have a national campaign as well as some state-specific campaigns. And so that the last link on your screen is for the Maryland campaign. Nikardi?
Great, thank you so much, Tam. My name is Nikardi Jala, and I'm an epidemiologist at the Maryland Department of Health within the Center for Tobacco Prevention and Control. And so our center, we are located in the Prevention and Health Promotion Administration, and this is our mission and our vision. So our vision is to promote and improve the health and well-being of all Marylanders, and we envision a future in which all Marylanders can reach optimal health and well-being. So today in this presentation, we'll go over what we know about food insecurity data and the availability of that data. Then we'll give a quick overview of the Maryland Youth Risk Behavior Survey and Youth Tobacco Survey. Following that, we'll go over the results of the survey and kind of see what the disparities were. And then we're gonna talk about key strategies to reduce food insecurity in your state. So now I'm gonna pass it on to Tam to start us off.
Thank you, Nikardi. So we're going to start with understanding and measuring food insecurity. I think it's safe to assume that all of us are here today because we care about the problem of hunger and food insecurity. And I think it's important to start with some clarity about what the problem is. The USDA defines food insecurity as a household level economic and social condition of limited or uncertain access to enough food. We know that before the pandemic, about 14% of US households with children were food insecure. In contrast, in addition to that, hunger is a feeling of discomfort or weakness caused by a lack of food. And the USDA defines hunger as an individual level, physiological condition. Forgive me, I'm gonna have to turn off my my notifications because I get so easily distracted by those. So forgive me for that. So it's a hunger, of course, is an individual level condition that may result from food insecurity. So although we often use these two terms as synonyms, they really are different but related. And we know that people who are food insecure may skip meals or eat less than they need and therefore experience hunger. So food insecurity is measured at the household level by the US Census, and prevalence data is reported at the national and state level. Food insecurity rates are not generally available at the jurisdiction level, such as at a county or school district, nor are they generally available among adolescents specifically. The Census and USDA has a few very similar food insecurity screening tools, including a 9 and 6 item screen, as well as the simplest one is the 2-item screen, which is here on the screen. And those questions are, within the past 12 months, we worried whether our food would run out before we got money to buy more. And within the past 12 months, the food we bought just didn't last and we didn't have money to get more. So as we know, at the national level, about 14% of households with children experience food insecurity. And rates of food insecurity are higher for Hispanic and Black households, as well as households headed by a single mother, and of course, households that are in poverty as well. In addition to the national level data, USDA also reports food insecurity rates for each state. And as this map illustrates, the prevalence rates vary considerably from state to state. So the lowest was 6.6% in New Hampshire. And the highest was 15.7% in Mississippi. So I have up here screenshot from one of the movies that I like, Alice in Wonderland. And so the question here for us is, where do we want to go? And that's the question the cat is asking Alice. And so the question is, do we want to end hunger or do we want to end food insecurity? So this question is important in part because the destination determines which road we take. So if we aim to end hunger, the solution or the road that we take is to provide food. If we are aiming to end food insecurity, the solution is to ensure that all people at all times have enough food to live an active and healthy life. Food security requires that food is both physically and economically accessible. So how do we know if we're moving in the right direction towards our destination? If we're seeking to end hunger, we can measure our impact by the number of pounds of food we provided or the number of households we served. And if we're seeking to end food insecurity, we can measure our impact using the food insecurity rate. Food insecurity data can also be used to identify communities that are disproportionately impacted and design interventions for those impacted communities. So I believe we all want to work to reduce food insecurity, and we are all working really hard to do that. But the question is it working? And how do we actually measure that impact? So for No Kid Hungry and other anti-hunger organizations, and I'm sure many of you on the call, a lot of our work is school-based. And of course, this is also pre-pandemic, since school is not in session in many places. But some of the work that we do at No Kid Hungry is working to increase access to the school breakfast program, advocating for universal free school meal programs like the community eligibility provision, after school meals, summer meals. In general, our goal is to reduce food insecurity for kids. So not having food insecurity data at the school level is a real problem. And so the first thought may be that we just need to collect the food insecurity data ourselves and do food insecurity screenings. Unfortunately, that is a very time-consuming and expensive process. And any of you who have done that yourself, I have had some experience with the IRBs, and I do not wish to repeat that because it is not fun. So instead, what we did was we worked with the Maryland Department of Health to add the food insecurity screening questions to the Maryland Youth Risk Behavior Survey and the Youth Tobacco Survey. And so I'm going to pause now to see if we have any questions before I turn back over to my colleague, Nicardi. She's going to share some information about the survey of middle and high school students in Maryland. If you can feel free to unmute if you want. We have a small group, so that's fine. Or you can put something in the chat if that's better.
All right. Well, if there are no questions, I'm going to give a quick overview of the Maryland Youth Risk Behavior Survey and Youth Tobacco Survey. But before I start that, we do have a quick poll that Mary will kindly start up for us regarding your awareness of the Youth Risk Behavior Surveillance System from CDC. So please vote.
So I believe that you should be able to see the poll. I've opened it to all participants besides hosts or co-hosts of the Zoom call. So it looks like we have some folks joining and putting their information in. We've got a couple more folks we're waiting on, but mostly there. And can you see the results, Nicardi?
Yes, I can.
Fantastic.
Okay. So I'm going to close it in a few seconds, and then we'll see what the results are. Okay. All right. So it looks like there are a lot of people that are not familiar with the CDC's Youth Risk Behavior Surveillance System. So it's really good that I'm going to do a quick overview of what that is. And some people are somewhat familiar and some are moderately familiar. So thank you so much, everyone, for doing this poll. All right, so the Maryland Youth Risk Behavior Survey and Youth Tobacco Survey is actually a combination of CDC's Youth Risk Behavior Survey and CDC's Youth Tobacco Survey. So in 2000, we began collecting jurisdiction level data on our youth, our high school and middle school students. We began collecting tobacco use behavior data, and that data was done because data collection on tobacco use behavior was mandated at the time, and we used the Youth Tobacco Survey. Then in 2005, the Maryland State Department of Education began collecting CDC's Youth Risk Behavior Survey data. And so the Youth Tobacco Survey is primarily tobacco focused, and then the Youth Risk Behavior Survey measures a variety of priority health risk behaviors. So MSDE, or the Maryland State Department of Education, collected this data at a state level only, and only in high schools. And so to reduce survey burden, we combined the two surveys in 2013 into one survey so that we could survey high schools and middle schools at a state and jurisdiction level. And then in 2014, we moved the survey to kind of avoid spring testing. And so now we've had 4 administrations of the combined survey since 2013. Okay, so the combined survey contains about 2/3 of CDC's core questions. CDC gives us a core survey to choose from, and we have to use 2/3 of those questions. And then we pick an additional 1/3 youth tobacco survey questions and other stakeholder questions. And so there are unique instruments for both middle school and high school that measure these risk behaviors. And Maryland is actually one of 5 states that has jurisdiction level data. Most states just do a state level administration. And the survey is only 45 minutes and is confidential and anonymous. And after survey administration, CDC cleans the data and produces tables and figures for all of our jurisdictions. The survey also collects data on key demographics, including sex, age, race, ethnicity, sexual orientation, and transgender identity on the high school survey specifically. So the results of the survey are used in several state level reports. Local health departments, students, schools use the data in their own work, and the data determines funding for our local health departments in regards to tobacco prevention funding. This data also provides evidence for evaluation of programs and interventions. So how do we go about adding the food insecurity questions to the Maryland YRBS YTS? So as mentioned earlier, the Maryland YRBS YTS is administered in the fall of even years. We usually begin drafting the survey questionnaires in late January, and there's about a 6-month process for everything, with approvals required from senior leadership at both the Maryland Department of Health and State Department of Education, and sign-offs from CDC and our IRB. So in August of 2016, Tamlin reached out to the Maryland Department of Health to ask about adding those 2 food insecurity screener questions that she mentioned earlier. Unfortunately, at that time, the survey had already been approved by CDC and IRB, and we could not move forward with those additional questions. So Tam reached out again earlier in the year in 2018, and we were able to submit 2 questions for CDC for review. And so the 2 questions that we ended up adding to the survey, and these were approved, was during the past 12 months, how often was your family worried that your food would run out before you got money to buy more? And then during the past 12 months, how often did the food your family bought not last and they did not have money to get more? And so food insecurity in this case will be if students responded often or sometimes to either of these questions. All right, so now let's get to the results. In the 2018-19 school year, 184 high schools participated and 181 middle schools participated. This is about 68,000 usable surveys, so a really large sample size. We had an 80% response rate for high school and an 83% response rate for middle school. And CDC only requires a 60% response rate in order for the data to be weighted as representative of all Maryland public high school and middle school students. So we were well above that. This map details food insecurity by jurisdiction for high school students. And here we see that Baltimore City, Prince George's County, and Somerset counties had the highest food insecurity prevalence, whereas Howard County, Carroll, Calvert, Frederick, and Montgomery counties had the lowest. And so most of Maryland's urban counties are here in the center. And a lot of the more rural counties are at the edges here. Okay, so in this slide, we are showing food insecurity for high school students by several demographics. Overall, 28% of high school students are food insecure statewide, and Black and Hispanic students are significantly more likely to report this than white students. And there was no difference by sex or grade. And we can see that difference here. So let's take a look at the questions separately. So I know we talked about combining them to get the overall food insecurity variable, but now we're going to look at the questions separately. So this figure represents the results for high school students who reported that their family was often or sometimes worried that their food money would run out. And there are about 22.5% of students who reported this. Female students were actually more likely to report this than male students, and Hispanic students were significantly more likely to report this than white students. And both Hispanic and Black students had a pretty high rates of this compared to white students. Now let's look at the second question, which asks about reporting that often or sometimes the food their family bought did not last. And so over 17% of students reported this exposure. And Black and Hispanic students, again, significantly more likely to report that the food their family bought did not last. So I just wanted to return quickly to the overall food insecurity slide to show how these two questions combine. So we saw that 22.5% of students reported worrying about food money, and then 17.3% of students reported that their food did not last. And this combines to an overall food insecurity for high school students of 28% in Maryland. So I wanted to take a deeper look at race and ethnic disparities in food insecurity for Maryland. And here you can see that all other race and ethnic groups other than Asian and white have food insecurity prevalence above 30%, so pretty high. Okay, so taking a look at the percent difference between minority racial and ethnic students that were significantly higher than white students, we see that Black students and Native Hawaiian and Pacific Islander students had the highest percent difference in their food insecurity rates. So now we can move on to middle school. Here's a similar map for middle school. And here we see again, Baltimore City and Prince George's County as highest in food insecurity. But instead of Somerset, we have Wicomico County as highest food insecurity. And then lowest, we have Howard, Montgomery, Frederick, Carroll, and Queen Anne's counties. Okay, so looking at food insecurity for middle school students by key demographics, we see that overall 25% of middle school students report that being food insecure. And again, a significant disparity exists between Black and white students and Hispanic and white students. Now we'll look again at the questions separately. This figure represents the results for middle school students who reported that their family often worried about their food money running out. And there were about 19% of students who experienced this. And Black and Hispanic students were significantly more likely again to report this. There is actually a 2.2 times greater disparity among Hispanic students compared to white students in this case. And female students here more likely to report that their food did not last. or the money that they had did not last for food. Now this figure shows the second question. So we're looking at students, middle school students who reported that the food their family bought not lasting. And so again, Black and Hispanic students are significantly more likely to report this, that the food that their family bought did not last. And we can see that difference here. All right, so returning to the overall slide, just to kind of go over how these questions combine. So 19% of students reported worrying about food money, and or 16% of students said their food did not last. And this combines to an overall prevalence of 25.2% for middle school students. Okay, so taking a deeper look again at food insecurity by race ethnicity for middle school, we see a little bit more variation here, but there's still a significant difference for a lot of the minority ethnic groups for food insecurity. So looking at the percent difference, Black and Native Hawaiian Pacific Islander students again have the highest percent difference, not as high as middle school, but still pretty high. Okay, so let's take a step back and think about the overall food insecurity measured on the survey among middle school and high school students. So high school students reported food insecurity at 28%, and middle school students reported food insecurity at 25.2%. So we were thinking about the why that would be. Why do high school students report food insecurity higher than middle school students? And one reason could be awareness. So high school students could be more aware of their family's reactions to insufficient funds for food or the food in their households not lasting because they missed a meal or they saw their parents miss a meal. The second reason could be that there's recall bias. So this is a limitation of a cross-sectional survey. It might be harder for younger students to remember what food they ate or if they had money for food or if their family's food lasted. And so recall bias can be something that causes the difference here. And also the third reason I have here is independence. So many high school students have more control over their meals. They may make their own meals, cook for their families, or have to buy their own meals and figure out how to get that. So it's easier to remember not having money for food or not having food when that rests on your shoulders. So just a quick overview of all the disparities that we saw in the state. As we saw on the maps presented, the rates of food insecurity are higher in urban counties like Prince George's and Baltimore City, as well as rural counties like Somerset and Wicomico counties. There are also disparities of food insecurity among the LGBTQ community. We saw that 26% of students identifying as heterosexual or straight are food insecure, but this is compared to 37% of students identifying as gay or lesbian and 38% of students identifying as bisexual. So there's a large significant difference there. And also nearly half of high school students who identify as transgender reported being food insecure. As presented, the disparities for students of color are also striking. Among high school students, nearly half of all Native Hawaiian and Pacific Islander students are food insecure. 1 in 3 Black students and Hispanic Latino students experience food insecurity. And these disparities in food insecurity are a leading cause of poor health outcomes. So food insecurity does put these students at an increased risk for poor health and increases participation of risk behaviors for those who are food insecure. And we will review some of that data now. Okay, but before we get to that, I just wanted to highlight the racial and ethnic disparities at a local or county level that we saw. So this is data from Montgomery County in Maryland, and the racial disparities here were the worst in the state. As you can see here, Hispanic Latino students in Montgomery County Public Schools experience food insecurity at 4 to 6 times higher rates as compared to their white peers. The disparity of for Black African-American students is also disturbing, with food insecurity rates that are 3 to 5 times higher. These disparities in food insecurity are among the causes of health disparities. And research does show that food insecurity is linked with many poor health outcomes, including higher risk of developing diabetes and depression. So I did perform some regression analysis to see what the risk behaviors are for students who are food insecure. And so this slide shows that high school students who are food insecure have a 1.5 times higher odds of of being overweight or obese, 1.5 times higher odds of alcohol use, 2.1 times higher odds of tobacco use, 2.1 times higher odds of creating a suicide plan, and a 2.2 times higher odds of feeling sad or hopeless for 2 weeks or more, and a 2.3 times higher odds of fighting at school. And so we do see that food insecurity does play a role in all of these risk behaviors. And here we can see that food insecure high school students are significantly more likely to be overweight or obese, currently drink alcohol, currently use tobacco, make a suicide plan, feel sad or hopeless, and have a physical fight at school. And so here you can actually see the difference in the percentages for those students who are food insecure and those who are food secure. Okay, so I did something similar for middle school for the regression. And so for middle school, we see that middle school students have a 1.2 times higher odds of having asthma, a 2.1 times higher odds of alcohol use, a 2.3 times higher odds of tobacco use, a 1.9 times higher odds of making a suicide plan, a 2.6 times higher odds of feeling sad or hopeless for 2 weeks or more, and a 1.5 times higher odds of ever carrying a weapon. So we see that those students who are food insecure are at risk of these risk behaviors. And here we list the percentage differences between the students. So food insecure middle school students are significantly more likely to have asthma, drink alcohol, use tobacco, make a suicide plan, feel sad or hopeless, or carry a weapon. And the differences are significant here. Okay, so our data also shows that food insecurity is a protective factor against adverse childhood experiences, which is a good thing. So in addition to the food insecurity and security questions for the survey, we asked 4 ACE or adverse childhood experience related questions to the survey. And that measured students' exposure to mental illness, substance use, emotional abuse, and household incarceration in the home. So food insecurity did lower the likelihood of current tobacco use, feeling sad or hopeless, and drinking alcohol compared to those students who were food insecure. And you can see the difference in students who are participating in those risk behaviors who have 4 ACEs and then who are food insecure, and then those students who have 4 ACEs and are food secure. And you see that the percentage is much lower for students who are food secure, even though they had experienced those 4 adverse childhood experiences. Okay, so in summary, we find that significant rates of food insecurity exist in Maryland, and there are disturbing disparities in food insecurity for many students of color and many minority groups like LGBTQ students. And we find that food insecure students are more likely to be overweight or obese, live in unsafe neighborhoods, engage in risky behaviors, and to have mental illness. So we also know that working to increase food security will decrease the negative health outcomes that are associated with food insecurity. All right. So we're going to talk about some strategies now to address food insecurity. But before we do, I did want to pause for any questions or comments about the Maryland YRBS YTS or any of the data that I just presented.
And while we're waiting for people to formulate their questions, I will just speak to the question in the chat about that Minerva wrote that she wasn't aware of the there being a significant population of Pacific Islanders and Native Hawaiian students in Maryland. We did have enough to be able to report back on their food insecurity rates. There were not enough students to be able to report on those categories by county, but there was enough to be able to report for the entire state. So I don't know if there's anything else you want to say as the data expert, Nicardi, on that.
Yeah, no, you said it correctly. You said it wonderfully. So yes, we do have enough students who are Native Hawaiian Pacific Islander to report on statewide disparities. But again, there are not enough students to report at a county level. And so we are unable to get that at a county level, but we can get data on those students at a state level. And there will be a link where you can see, you can access that data. So at the end.
And we also had a question about the odds of food insecure students being more likely to engage or to engage in risky health behaviors. I don't know if Ashley, you could, I'm referring to Ashley's question in the chat, and if you want to unmute, you can. Nicardi did present some of that data during her presentation. So there were 2 slides, one about high school students and one for middle school students. So here's the slide for high school students showing.
Yes, that was the slide I was looking for. Thank you so much.
It went too fast, perhaps. Yes. And we have a question also from Minerva about wondering about the parents and how aware they are of these statistics. I don't think parents are really aware at all, quite frankly. Unfortunately, the data from this survey was analyzed and released during COVID. And so it's been a challenge to get the message out there. But it will be really interesting, I think, if other states also use these questions on their survey so that we can compare the rates in Maryland to other states. There haven't been, I'm sure as you know, Minerva, there haven't been that many surveys done of adolescents themselves. But we do know that families with teenagers do have higher food insecurity rates. And so there are some signs pointing towards that, but I think there's much more work there to be done.
Right. Yeah, and just to follow up on that, we do plan on releasing more of this data to school systems. So we're working on like 1-pager just to get that data out to the schools, and hopefully that will get the data to the students and then to the parents. But yeah, everything is harder during COVID. The data did come out right before COVID started, and with all the analysis, most of these presentations have been during COVID. So we hope that more people can access this data. And that's why we do have the data available for people to do a lot of their own data queries and things like that, if they're interested. Oh, thank you, Minerva. I just saw Minerva's comment about context. Yeah, we actually, Tim and I, we did a presentation for Montgomery County for their food equity group.
Yeah.
And yeah.
Policy council.
Yeah. So yeah, they are aware of the data. I'm not sure what they're doing to disseminate it, but thank you. That would be great.
Okay, I think we can jump into the last section of our presentation, which is about the strategies to reduce food insecurity. Thank you, Nicardi. So given the really high rates of food insecurity that Nicardi just shared with us, and also given the striking racial and ethnic disparities in food insecurity rates, we simply must take action to address this. And I know I'm preaching to the choir. So as we all know, food insecurity exists when a household does not have reliable access to the healthy food they need. But understanding why food insecurity exists or the root causes will really help to guide our work towards effective interventions. So there are two key components of food insecurity. They are a lack of physical access and a lack of economic access to healthy food. So families may experience a lack of physical access to healthy food if they have, if they're elderly or disabled and therefore have difficulty getting to food stores, or if they have other transportation barriers. Another key reason why some families may experience a lack of physical access to healthy food is that they may live in a community that does not have a grocery store nearby. So these communities are sometimes known as food deserts or healthy food priority areas, or the term food apartheid is also used to describe them. And these neighborhoods were created by us as a society through policies that have concentrated poverty and segregated communities by race. Families may also experience a lack of economic access to healthy food in areas with high housing costs and in areas where the minimum wage is insufficient to meet one's basic needs. So for most people in the US, there's a more than adequate amount of food that is physically available. And the primary cause of food insecurity for most is that healthy food is not economically accessible. Okay, next slide, please. Thank you. So the question of why food isn't economically accessible, there are two key reasons. One is the high cost of housing. So a one bedroom in the Baltimore area, for example, is over $1,000 a month. If you're interested in finding out what the cost of housing is in your community, I put the link up here on the screen. And probably another key, really important reason is the inadequate minimum wage. So the minimum wage right now in Maryland is $11 an hour. So if you work full time at a minimum wage job, your income is less than $2,000 a month. And a living wage for Maryland is about $15 an hour for one person. And for one adult with one child, it's closer to $30 an hour. And so this is, there's a really great website, livingwage.mit.edu, which is again linked on the screen, where you can find the living wage for your community. It's broken down by state and by county. And you can also see all a wide variety of family types. So if it's a single parent or two parents, one parent working, one parent not working. So I encourage you to check that out. I think it really helps to understand why there are so many people that are struggling. So I'd like to discuss some key strategies to ensure that all students have reliable access to healthy food, both at school and at home. We know that schools can work to increase access to school meals, and we can also ensure that students have reliable access to healthy food at home by increasing access to SNAP. And SNAP is simply the single best strategy we have in this country to reduce food insecurity. Okay. So in order to, one of the goals that we have is to ensure that all students have reliable access to healthy food at school. Students can receive free meals at school if their family income is below 130% of the poverty level. They can receive reduced price meals if their family income is below 185% of the poverty level. And so what this means is that a single parent with one child who has an income of $32,000 a year does not qualify for help with meals at school. So this chart here shows the income guidelines for free and reduced price meals for the current school year. So this is for a single parent with one child. They must have an income below $22,412 annually to qualify for free meals at school. And to qualify for reduced price meals, their income must be below $31,894. However, a family like this, which is a single parent with one child, needs an income of at least $61,450 to survive without assistance in Maryland. That is a huge gap. And again, this number is from the livingwage.mit.edu site. And again, I do encourage you to check that out. I'm not getting any kickbacks from them, but it's just a really great site. And it helps to really paint the picture of what it is that you need, just very basic housing costs, food costs, transportation, medical care. That helps to paint the picture that there's this large gap of many families that fall in between that the maximum income for assistance with school meals and how much you actually need to survive. So there are many families that are not making ends meet. So programs like universal free school meals are one strategy to address the families that fall into that gap. The community eligibility provision is a federal school meal funding option that allows schools to provide free breakfast and lunch to all students. And CEP removes barriers to participation in school meals, including the cost, as well as stigma that these programs are just for poor children. So Baltimore City is using the community eligibility provision district-wide. And as a result, they started serving an additional 10,000 lunches every day. Quite remarkable. It's about over a 20% increase in lunches served. Because of that, the federal reimbursements increased by nearly $10 million per year. Again, quite remarkable. They were able to double their fruit and vegetable purchasing contract from 3 to 6 million. And they were able to bring on a lot of staff that had been part-time to bring them on to full-time status. And then of course, one of the great benefits of CEP is that you don't have to collect the meal benefit application forms. Because there are about 85,000 students in Baltimore City schools, that's how many forms they had to print and distribute and collect, and it required a lot of administrative work to do that. There was a recent study by Johns Hopkins University to study the impact of CEP, and it found significant impact on food insecurity rates. So in this study, food insecurity screening was conducted in CEP schools and schools that were CEP eligible but not enrolled in the program. The study found that students attending schools with CEP were nearly 3 times less likely to be food insecure as compared to students attending a comparison district school. And this was even after adjusting for race and ethnicity and the education level of the adult. The study also found improved attendance rates in elementary and middle schools, as well as improved grade 10 promotion rates. As part of the study, we conducted focus groups in CEP schools, and I'd like to share a little bit of the feedback that we gathered from those focus groups, including this quote here from a parent in a CEP school, and I've asked Nicardi to read them out loud, please.
I will read them. So before CEP, if they didn't qualify for free lunch, we were packing them lunch. Sometimes when you don't have a lot of money to buy groceries or food for the children, you don't send them with food at school. Now, all the children have free food, the breakfast and the lunch. And I think that is good for everybody. And next quote, I think it's great that there is the CEP program. I know from a fact that there's a lot of families that the only meal they have here is at this school. And the next quote, maybe at the time when you apply for free and reduced price school meals, you don't need it, but things can change throughout the year. Sometimes there is more work than other times. It can get messy and is a problem. The kids should always be able to have food at the table. All right.
So we also did high school students. We asked them in CEP schools what they felt about CEP. And here is some of the feedback that they shared. And I'm going to just zoom through this a little bit because we are getting close to the end of our presentation. The next slide has some feedback from school administrators in CEP schools. And I found these to also be really interesting, including the last one where the administrators shared that they had problems with students stealing food before CEP was implemented. So one of the reasons why we wanted to talk about CEP today was that it provides a unique opportunity with COVID-19. There is a bit of a silver lining. There's not much of a silver lining with COVID-19, but there is a bit here because eligibility and reimbursement for CEP is, oh, I see a typo there. Sorry, it's CEP, not CPE, but I know you know what we're talking about, so that's okay. Used on so that's based, eligibility and reimbursement both are based on the school's identified student percentage, or ISP. And due to the pandemic, more students than ever are participating in safety net programs like SNAP and TANF. And this is important because CEP can CEP is based again on the number of students in these programs, and because because the enrollment in those programs has gone up so dramatically lately, many more schools are eligible for CEP. So I encourage you to look into that in your community and encourage schools to participate. In addition to increasing access to school meals, we can also ensure that all students have reliable access to healthy food at home by increasing access to SNAP. The Supplemental Nutrition Assistance Program, or SNAP, I'm sure we all are familiar with that. SNAP has been proven to reduce food insecurity by about 30% and child poverty by about the same amount. We also know that it's an economic stimulus and reduces healthcare costs. And I'm wondering if folks in the group, we have a quick poll that we're going to put in the chat. If folks know what the minimum SNAP benefit is for one person. So if you qualify for SNAP, you'll get at least how much per month is the question. If you have a guess, or if you know, you can put it in the chat. I know some of you know, perhaps everybody knows the, if you have a guess, or if you do know, you can go ahead and put that in the chat. We can go ahead to the next slide while we're waiting for some responses. So one of the reasons why, or these are some of the reasons why SNAP is underutilized. So we, of course, especially in the past 4 years, we've had a lot of concerns about use of SNAP being used against you when you apply for citizenship. Of course, there still is a lot of stigma as well around the program. There's a lack of information as well as some misinformation about the program and who's eligible. The application process can be quite long, and folks often have to recertify as often as every 6 months. And the last main barrier that I have here is the low benefit amount. And so in general, the minimum benefit, which again is set at the state level, Olivia got it right, it's $16 a month, excuse me, per person is the minimum. And it's really hard to sort of wrap your mind around that. It's such a low amount. It's obviously insufficient to be able to really support folks. The maximum is closer to the other guest that we had, which is the maximum is just under $200 a month for one person. So again, these are numbers that are, I think, important for us as advocates to know, because the sometimes what you'll hear sort of in the popular media is that folks are taking advantage of the program and are living off of lobsters and steaks, and that's just simply not true. The average SNAP benefit for one person in Maryland is about $120 per person per month, but the minimum is $16. So one thing that we've done in Maryland is we've done some advocacy to try to address that minimum benefit and that low benefit amount. And I just wanted to share one example before we open up for questions that I'm really excited about. It's a new program in Maryland called Summersnap for Children. It passed in 2017, I believe it was. So this is a strategy to increase access and participation in SNAP by increasing the benefit amount to better address the needs of families. So this program is addresses the food insecurity increase that occurs when schools are closed during the summer and winter breaks. It is a state and county funded SNAP supplement. It's for low-income children under age 19 that are enrolled in SNAP. It provides $30 extra per child per summer month and $10 during the winter break. The money is issued directly onto SNAP EBT cards 15 days after the regular SNAP benefit, the federally funded SNAP benefit, is issued in June, July, and August. So this program just started. So it was the first year that it was implemented is this year, this summer, 2020. So we don't have any impact data yet, but Summersnap for Children is based on Summer Electronic Benefits Transfer for Children, which is the federal program that provides a monthly benefit for students during the summer, which is also what the PET program is based on as well. So that's just a little example of what some of the things that we can do to improve access to SNAP. And I'm going to turn it back over to Nicardi now to wrap us up and open up for questions.
Yeah, thank you so much. Okay, I'm not unmuted. Great. Watch everyone. So here I'm just providing the links for several resources. So Tim worked really hard on this report that we put together on this on the data, and so we worked with different groups to create this report, and that's at the first link. And it just goes over what we discussed today and a few extra things. And then the second link is the link to the YRBS YTS questionnaires. And so these questionnaires, we create them every survey year, and you can see what questions were asked on the survey. And then the last link is actually our Maryland indicator-based information system website. So users can make their own data queries on all of the data that we collect in Maryland. And then there's youth data, like I discussed today, and also adult data that you can take a look at. So we both want to thank you so much for the invitation to speak today to share this important data. Thank you to the organizers of this summit. This work is so important, especially now with the pandemic, making food resources and access so difficult for many families. And so thank you so much for our session producer, Mary, for all your assistance today. And then this is our contact information on this slide. So if you have any questions, please be sure to reach out to us. And I'm just going to go to the next slide to show the poster that we created for the data. And I'm just going to leave it here while we answer any questions that you may have on our presentation. So thank you.
It looked like we had a question from Denise earlier about mentioning again who you presented the data to in Montgomery County. Can you remind us?
Yes.
The meeting was put together by the Montgomery County Food Policy Council. And they've been meeting since COVID. They've been working with the Department of Social Services on the COVID response. And so they worked together to put together a meeting that was just for this purpose. And again, I have put the link to the report in the chat if you are interested in checking that out. And the poster, which Nicardi brought up, has some of the information that we went over, but also summarizes some additional information. So,
and if Denise is interested in the data specific to Montgomery County, we do have the slides for that presentation that we did, so we can also share that with her.
Yeah, and I think, did they record it, Nicardi?
Not sure.
I'm not sure. We can check with Heather Bruskin with the Food Policy Council. I believe it may have been recorded because we did provide a lot more very Montgomery County specific data that you may be interested in if you work in that county specifically.
Mm-hmm. We do have time to take some questions if anyone would like to either put it in the chat or feel free to unmute yourself and ask.
I do have a question for everyone, myself, and that is, I'm wondering if anyone has interest in potentially trying to get the 2-item screen added to their youth risk behavior survey in their state, if they're not from Maryland.
Great. Well, the process, it's something. I was just going to say, the process for adding questions, it does depend on the state, but usually each state will ask for stakeholders, they'll reach out to stakeholders to submit questions. And so CDC will usually go through any requested questions and make any modifications. So as you saw, Tam sent the USDA screener questions, but those questions were changed a little bit to fit the YRBS protocols. So if you are interested in the 2 questions that we asked and you want to propose it to your state, definitely reach out to me and I can get you that information.
Great. Well, we're right almost time. And so if no one else has a question, shall we wrap things up? Great. All right. Well, thank you so much to both Tamlin and Nicardi today for sharing your expertise. Very important information. Thank you. If you want to keep the conversation going in Whova, you can do so in the community boards or in this session in Whova. You just navigate to the view session area. And coming up next is a panel that showcases how some hunger-free communities have responded during COVID. And we look forward to seeing you there. Thanks so much for joining us.
Thank you all.
Thank you.
Thanks.
Thank you, Mary. It was
All right,
very
you're
helpful to have you.
welcome anytime. Hope you have a great day, Tamlin.
Thanks, you too.
Okay, bye.